probably about March time, end of March time, basically demanding that why can't one of the hospitals be named after Mary Seacole? And Mary Seacole, to remind you, was voted in 2004 as the Great Black Britain of All Time by a public opinion poll that I launched, and she's actually now in the book 100 Great Black Britons, which is in all good bookshops. And thing about Mary Seacole, she was also in the Crimean War, same time as Florence Nightingale, and the historical records showed that she actually approached Florence Nightingale to work with her to be a nurse, and she got rejected, which is the story of migrant workers all over again, and that was back in the 1850s. And she decided to do her own thing, create her own hospital, the British Hospital, and looked after nurses, looked after the soldiers on the front line. As a result of the campaign I did back in 2004, the Royal College of Nursing adopted Mary Seacole on the same standard of footing as Florence Nightingale. So when NHS England launched their hospitals called the Nightingales, I did an online petition, used change.org, to something like sounds in the background, change.org. I don't know who's speaking. Can they mute or whatever? Thank you. So I launched this petition, basically, you know, why can't you name one of the hospitals after Mary Seacole? You know, she's just as equal, just as important as Florence Nightingale. 15,000 people signed my petition in a week. There was a lot of media coverage, and what happened was further exposed that you've got the NHS, the biggest employer in Britain, employing large number of staff, from clinicians to frontline workers working in NHS, and there's no acknowledgement by the NHS or the Department of Health that these migrant, some of them migrant workers, but some of them are British, who've been here for many decades, different generations, not being valued and recognised around the issues around equality and diversity in NHS. And to cut long story short, eventually they did name one of the hospitals after Mary Seacole. It's actually in Surrey. It's an emergency. It's actually a rehab hospital for patients having long-term impacts of COVID-19. They named and it's named Seacole Hospital. That was announced in June a few months ago. So that was, but it only happened because I was lobbying, and lots of lobbying within NHS England and Department of Health for it to happen. So that was kind of a recognition of frontline staff, workers, migrant workers working for the NHS. So I think that was the first campaign which I got involved around this whole stuff around COVID. The second stuff, I mentioned about the work around Ubele, but also during that time, I lost my brother-in-law to COVID-19. He died in Derby in his early 50s. I don't want to go into great detail because it's still very difficult for me and my family. So as a result of his death, we, like other families, I remember there's been 60,000, probably more families who've lost loved ones because of COVID-19. And I think in 1 in 3, definitely 1 in 3, maybe 1 in 4 of those families are connected to a BAME community of some sort. As you know, in the early days, there were lots of Filipinos that were deeply affected by and this, I'm not quite sure whether Danielle's going to touch on this in her research work, but what was quite clear that a lot of Filipino workers who died of COVID-19 working for the NHS, their status, their status wasn't permanent. So they were very quiet, to be quite honest. They couldn't really articulate in the ways that we could articulate about the disproportionality in their community, because they were fearful of their contracts could be terminated, which means they'll be essentially deported back to the Philippines, because the NHS has for the last 10 years now has gone on a massive recruitment drive around the world to recruit nurses from the Philippines and from the Caribbean and other parts of the world as well. But what happened was, because of the definition of what is a key worker, not key worker, that caused a lot of media attention again. And then I know there were meetings with Home Office and Number 10 with the Filipino community, and they've resolved partly their status for the time being. So that's another small mini victory. I wasn't directly involved in that, but I worked very closely with the Filipino community around the wider campaign. But as a result of the death of my brother-in-law, a lot of families like ours, have different, the whole bereavement process has changed. You can't say goodbye to your loved ones, you can't bury them in the way you want to say. So I launched the Majority Fund in partnership with New Ballet, so to raise money through GoFundMe. And the idea of that fund is to do two things: to provide some initial funding support for BAME-led counselling services, to provide bereavement support, because there isn't a national offer if you lost a loved one. I remember, we probably lost about 10 to 15,000 people in the space of 4 or 5 months from BAME communities as a result of COVID-19. And so, which means that the types of services that you would normally get aren't there to meet this demand. And obviously there's a delayed reaction in terms of how people will get bereavement support, but it's making sure there's an offer there available when people need it. So, so the part of that fund was to raise money, and the other part of the money that we're raising is for families to organise events, activities, or any form of memorial to say goodbye to their loved ones as we approach the first anniversary of COVID-19 next year. Linked to that, there's been a network been established called BAME Stream, and this is a network of BAME-led organisations like NASFIAT in North London, which has for the last 25 years has provided a whole range of cultural sensitive counselling services for different faith communities. BATAN, which is a network of Black and Asian counsellors and therapists, and also BAME members of the British Psychological Association. We've all come together working under the partnership with UBLA and BAME Voices, which is a network of, again, BAME therapists and counsellors, to provide the offer around bereavement support. So we'll be launching the first set of services. That's it. We'll be launching that in December, in the next few weeks, after next week, as well as the kind of the grant scheme that we're going to be launching next year as well. So that's kind of things I've been kind of heavily involved. We raised about £84,000 over the last 6 months, which has been great. Not as much as Captain Tom, but we're getting there. Any contribution will be welcomed. Also, next week is going to be the start of bereavement National Grief Week, and that's been organised by the Good Grief Trust. So we're working with them to make sure when we talk about grief that we recognise migrant workers, we recognise BAME communities, because often when you talk about grieving, it's still a very mainstream conversation. So it's making sure that our voices are reflected, because we're grieving too, and we also have a voice also. I'm happy to stop there and happy to answer any particular questions. Obviously, if you want to have more feedback, I'm sure on the Johnsy Fund and the work we can share, I'm sure Migrant Rights Network can share the website for information as well.
Great. Did anyone have any questions that they wanted to ask Patrick? Thanks so much for sharing that and just about all the work you've been doing recently and highlighting some of your important initiatives. Yeah, Zoe, do you want to feel free to unmute yourself and...
Hi, can I ask a question? Hi, Malia, and hi, Patrick. This is Zoe from JCWI.
Hi there.
Great. Hi there, how are you doing? It's great to hear from you. I just wondered if you could sort of comment maybe a bit about, I'm really sorry to hear of your experience, and obviously it's terrible how many people have gone through this awful experience of bereavement, and just given that there's these groups of bereaved families who are campaigning, feeling the need to campaign, feeling that the government hasn't responded appropriately yet or learned the lessons that need to be learned. I just wonder if you could maybe widen that out, because I know that you have a lot of experience with campaigning on other areas where migrants may justifiably not have much faith in public systems, and maybe talk a little bit about the trust issues that we have with migrant communities and BAME communities when facing government institutions at the moment, because I see that as a bit of a crisis. Would you agree?
That could be a whole seminar. Do you know that, Zoe? you put the cat amongst the pigeons there. No, seriously, it's a big issue. It's a big issue, as you know. That is still ongoing. Also, the work that with JC. I mean, I've worked closely with JCWI, as you know, especially the whole stuff around the Windrush scandal. And when we launched the Windrush Justice Fund, and the whole idea of that Justice Fund was to try and give grants to frontline community groups and organisations who are building that network of confidence so people can get advice and representation. Trust is a massive issue. I think that'll be a worthwhile conversation, a proper conversation, because I haven't really got time to go into the great detail, the minutiae of that, but I think that is worthwhile having another conversation of migrant networks, organising an event. How do you build trust? I mean, I think there's three things here. The voices, the lived experiences of migrant workers and the communities, whether experiencing hostile environment policy or other policies of government at a national level. And I think secondly, it's about the capacity building of organisations and BAME-led organisations and migrant right organisations to support those voices. I think that's really important. And I think thirdly and importantly is how you campaign for policy change, around a whole range of policies which has a disproportionate impact on migrant communities. So if you just look at COVID-19, that's the thing that we're looking at now, it's obviously the massive impact on people's employment opportunities, access to work, and if people's jobs are linked to employment and they've been furloughed, assuming that they've been allowed to be furloughed, and that's linked to their immigration status, and if jobs are going, then what does that mean to them? Basically, there are going to be more people that's going to slip through the net or be in this invisible economy of ducking and diving, which people are doing already. You know what I mean? And then I think the other thing linked to the COVID stuff is when someone's lost a family, a loved one, what support are they getting to meet their needs? So it's really great especially for those migrant workers from BAME communities. That's why I launched up the Mobility Fund to support that and the types of counselling. Which not only the support that NASFET's doing is only limited, there's only about a couple of counselling sessions they can do, but we want to influence the mainstream organisations so they can take on board a inclusive race equality perspective in their work. Because again, there are over 15,000 plus more individuals who have died of COVID-19, and if you multiply by that with family members who are grieving, it's like a tsunami of support that's required.
Thanks. I agree. We should talk about this more in terms of the trust issues, but yeah, thanks guys. I'm looking forward to hear the rest as well.
Okay.
Are there any other questions for Patrick before we send him off? No? Okay, well, thank you so much for being here. I guess we will move on then to Danielle. Danielle is a consultant with the Migrant Rights Network at the moment, and she's also a lawyer with Garden Court Chambers. And Danielle has a wealth of experience, particularly in representing children within the criminal justice system. She's also a committed member of Black Protest Legal Support, which was formed following the death of George Floyd in America, and has been responsible for training and coordinating over 100 barristers and solicitors as legal observers. And she has been the lead on MRN's survey on the impact of COVID-19 on migrant workers and communities of color. So she'll be sharing her findings with us now. So over to you, Danielle.
Thanks so much. Have you made me a co-host so I can share my screen? Oh, I'm now the host. Perfect. I put together some slides, but obviously, as Malia's already said, my background is not in migrants' rights at all. I'm a criminal barrister by day, but obviously the impact of the pandemic meant that I had much more time because the courts weren't sitting, and that's how I became involved in this project. And it's actually been a really, really interesting piece of work. So let me just share my screen. And I've made some, it's very gloomy outside today, so I've made some very bright and colourful slides. I'm not sure how appropriate that is in light of what we're talking about, but I just thought it might make it might make things a bit more interesting. So can everyone see my screen now, my slides? Yes, I'm getting some nods. Okay, so a little bit of background to the project that I've been working on. It was a project funded by the Paul Hamlin Foundation, and I came on board in about April or May, actually. The project's purpose was to gather information and understand BAME and migrant workers' experiences during COVID-19, and particularly as lockdown measures were eased and people started going back to work. So I think there was definitely a focus on return to work, but also we were looking at those industries where people had to continue working when everyone else was safely tucked away in their homes, working from home, etc. Migrants' Right Network partnered with 3 other organisations. You can see at the bottom there is the Kanlungan Filipino Consortium, Migrants at Work, and the 3 Million Project. So between the 4 of us, we had sort of a good breadth and depth of knowledge, and also access to sort of frontline workers themselves, because ultimately those were the people we needed to speak to. The project, in the project proposal, we'd narrowed down geographical locations and key industries that we wanted to focus on. So we were predominantly looking at London, the West Midlands and the south of England, and 4 key industries. So construction, health and social care, logistics and delivery, and security. I'll put my hands up. I wasn't involved in putting together the initial project proposal, so I wouldn't be able to answer any questions about why those key industries have been selected. I mean, obviously health and social care speaks for itself, and when we did the health and social care section, we made a decision to include social workers, for example, in our data collection. Construction, I imagine, because there was a lot of talk in the very early stages of lockdown about whether construction workers should be allowed to continue working when everyone else was locked down. So I imagine that's why they were included in the proposal. And then obviously logistics and delivery, well, they were key, weren't they, during lockdown 1, and the amount of Amazon deliveries that came to my house personally increased quite a lot. So I'm sure that was similar across the country. And security, generally speaking, the people we've spoken to are security officers at shops. So those key stores that had to stay open, Tesco's, Sainsbury's, Marks and Spencer's, etc. A lot of security guards were continuing to work, as I say, when everyone else was locked down. So our survey and our data collection, we used SurveyMonkey to host the survey, and the link to that was disseminated through existing networks that various project partners already had, social media platforms. So this image that you see on the screen now, that was tweeted out quite a lot. And we also found that there were a lot of WhatsApp group and Facebook groups already in existence that provided support for particular industries. So, you know, nursing in the West Midlands, for example, may have had a Facebook group, and the link was posted in there. We also had printed some postcards that we were sort of handing out, particularly to sort of security guards. You know, as I'd go and do my weekly shop, I might ask a security guard if I could give him a card, and it had a QR code on there, and people would scan that and it would take them straight through to the website. So we had 170 responses to the survey, and of those 170, we're able to conduct 14 case study interviews, which comprised of a sort of 1 hour long interview that was conducted over Zoom, where we just followed up on the questions that had been asked in the survey, and just tried to get a little bit more anecdotal evidence about what these frontline workers had been experiencing during lockdown. So in terms of the demographics, when the results came back, 37% of the respondents were male and 61% were female. In terms of immigration status, there was quite a spread, but 21% were British nationals, 22 had indefinite leave to remain. But we also had a handful of asylum seekers, refugees and undocumented migrants who completed the survey. 32% of our respondents were Filipino, and obviously Patrick sort of referred to that community specifically. I think that was because one of our partner organisations, Canlungan Filipino Consortium, had the direct contacts with the Filipino community, and within that community all of the respondents were healthcare workers. So we know that the Filipino community are hugely represented within the NHS and other health and social care jobs, and that I think is reflected in our survey. In terms of the geographical locations, it was sort of a relatively even spread, although 46% were from London, and as it says on the screen, 74%, so the vast majority were on some sort of permanent contract. And I mean, I think that's quite interesting because in terms of looking at how employers are treating workers, we're talking about people that should feel like they have job stability because, you know, the majority of them are on permanent contracts. But I think as you'll see, a lot of them didn't feel that during the pandemic especially. And then 53% were without recourse to public funds, and we were particularly interested in that because I think, again, I think it shows to a certain extent duress of circumstance, in the sense that a lot of these workers felt that they didn't have an alternative but to work through the pandemic, and that's because they knew that if they weren't working, then there would be no way for them to support themselves and their family. So just some headlines then from our survey, and I have to say I'm trying to not give like too much away, because obviously for my project I'm going to be doing a very, very similar webinar to this in a few weeks, so I'm just whizzing through and giving you the headlines, and if you've got any specific questions then I'll happily answer. But from our respondents, 82% were not offered the opportunity to be furloughed, so that was never something that was put to them. 21% were working more hours but for the same pay. 34% given more responsibility for the same pay, and then 44% of employers had introduced incentives such as free food or bonuses to improve employee motivation. And I suppose to a certain extent that can be seen as a positive. I think we had some anecdotes of people who were saying that employers had made efforts to ensure that there was food available when people were working, because, for example, local shops weren't open, so there was no way for them to get lunch. So employers would provide them, which is something they weren't doing before. Okay, so the headlines in terms of health from our respondents, 76%, so huge amount, felt that they were putting their health at risk by working during the pandemic. 72% experienced stress, 63% experienced anxiety, and you can see the list goes on: depression, burnout, exhaustion, insomnia, to name but a few. I don't think that any of that will come as a surprise to anyone, especially for people who have continued to work through the pandemic but have had the benefit of being able to work from home. I think a lot of people would also say that they'd experienced those, but obviously these frontline workers who were physically having to go to work, perhaps understandable why they felt that way. In terms of finances, 38% of our survey respondents said that they were concerned that they'd lose their job if they didn't go to work, and 54% couldn't afford to not work. And again, I think that will probably correlate with the amount of people that had no recourse to public funds, who indicated, who I'd sort of highlighted earlier in this PowerPoint. 28% felt obliged. 20% were concerned about the impact that not working would have on their immigration status, and 11% felt pressured by their employer to continue going to work. 31% of our respondents are now worse off financially. So despite having worked, they're not in a very good position. And 8% of those frontline workers, so people who were putting themselves at risk during the pandemic, were reliant on food banks during that time, and 11% of them were unable to pay their household bills on time, which I think really just sort of highlights the difficulty that a lot of these workers face, and really brings to light the unfairness of it. I should have made clear at the start of this presentation that our survey was only sent to, or we only targeted people from migrant communities or people of colour, and there was a sort of a question on the first page about where they were from, what their nationality was. So the results are exclusively people of colour. So I don't have any data to compare to white frontline workers who were working during that period, but this is certainly how the migrant community and how people of colour feel. So in terms of discrimination, 21% felt that their ethnicity influenced the way their employer treated them. 23% felt that their nationality influenced the way their employer treated them, and 14% felt that their immigration status had influenced the way their employer treated them. So quite interesting statistics, I think, in terms of discrimination. 28% experienced overt racist abuse, and 20% were required to undertake less desirable tasks than their white colleagues. And I think we had some anecdotal evidence from, I think it was a nurse who was basically saying that there were roles within the hospital that no, specifically linked to COVID, that no one really wanted to do, but it was certainly felt by this person that those jobs were always given to BAME workers, which is obviously a cause for concern. So just to sort of contextualise a little bit, I've just pulled up a few examples from some of our case studies. So this is something that a GP told us, that she'd been working non-stop around 12 hours a day, and then she'd spent her evening and weekends writing protocols. She said overtime was available, but it will never cover the number of hours that she was required to work. And obviously, there's been a huge amount of publicity about the extent to which the NHS has really come through during this very, very difficult time. But equally, it's very sad to see that there are members of that profession who feel like they're not going to be effectively reimbursed for everything that they've done. Our case study 2, this was a lady who was a neuroscientist, and she said that during the pandemic she'd experienced a lot of xenophobic abuse, not just from patients but also from the trade union movement and other representatives and union staff. And presumably this is as she's been pushing forward concerns about health and safety, insufficient PPE, for example. And she's described an incident where she had sectioned a patient, and she was told that he hoped she'd be deported back to Germany after Brexit. So obviously not limited or confined to the colour of people's skin, but also in relation to where people are from. Another case study, we spoke to a security guard when he was talking about some of his colleagues, and he said that many of his colleagues didn't understand their rights to challenge their employers, and the workplace culture in the security industry is that migrant workers do as they're told. So you just do your work and you don't ask any questions. And as a migrant worker or person of colour himself, that's what he had witnessed and he'd experienced. And in his view, the BAME workers were treated less favourably than their white colleagues, and he felt that was due to the fact that the management was overwhelmingly white where he worked. And then last case study example from someone who was a sleep-in care worker. So obviously quite a I think quite an important job. I think it, that must be an incredibly difficult job to do, particularly during a pandemic. But yeah, she said, if you stay at home on a reduced income, you can't keep up with living expenses. That is the main reason I go to work, plus family members back in Africa and my son rely on me. So obviously there she had dependents and other people that she was supporting outside of the UK, and that was a main motivator. So again, this theme of duress of circumstance, and the fact that there really was no alternative for her but to continue working despite feeling that she was probably putting her health at risk. So in terms of our project at MRN, our next steps, the full report to be published imminently. I'm laughing when I say that because I'm responsible for writing the report, and I've just had a really sort of incredibly busy couple of weeks being back in court. So that is due imminently, and that will be published via Twitter, and it will be sent out via email. The report's going to contain some industry-specific policy recommendations because, as I mentioned at the start, we focused on construction workers, security guards, health and social care workers, and logistic and delivery drivers. The reason we did that was partly because the government had published at the time industry-specific guidance, and we wanted to ensure that that guidance was being complied with by employers as a first step. And even if that guidance was being complied with, we wanted to ask our survey participants whether they felt that that was sufficient. And so we've had some feedback in each sector from those individual workers, and we'll be able to put in place some recommendations about what we say employers should be doing, and or whether the government guidance needs to change. And then hopefully before Christmas, we'll be able to put on a webinar, probably very similar to this one, to be honest. So this has been a nice dry run, where we can obviously report back our findings. I'd like to have some of the survey participants themselves speaking and providing those anecdotes about what their experience has been during the pandemic. Because I also think that it's really important that, as Patrick was saying, that that they're given a voice during this crisis, because they really are the individuals that have kept the country propped up. So it's important that when research like this is undertaken, they are very much at the centre of it, and they tell us in their own words, what they think needs to change as well. So those are really the findings that we have so far. Hopefully, if there are people on this webinar today that want to attend on the next occasion, you'll be able to. And yeah, just from a personal perspective, it's obviously been a really interesting project for me, someone who doesn't have a background either in working with the migrant community or indeed working sort of at a grassroots level. I've certainly learned a lot and been extremely humbled actually in the process of talking to these people, to see the sorts of sacrifices that have been made. I say sacrifices, but again, as you'll see if you read the report, it really has been duress of circumstance in some situations, and I think that's something that we need to look to address. Because it can't be right that there are particular groups within society that feel that they have no choice but to put their life at risk. So that's it from me, really. Those are the headlines. And if anyone's got any questions, my email address is there, or I'm happy to answer now if I can.
Yeah, if anyone has any questions, feel free to unmute yourself or say in the chat box. Nick, were you waiting or no?
First of all, thank you very much, Danielle, for that and very useful and in some senses damning information. I just wondered, because I mean, one of the things we probably need to do is to make a comparison with how similar workers in, whether it's the health sector or the construction sector, are being treated, and whether they felt any different to the way that the migrant community are feeling. So, I mean, I realise that wasn't the objective of the project to gather that information. But are you aware of any information that, say, has already been published, which won't obviously make a direct comparison with what the work that you've done, but so that we can at least make some sort of comparisons around certain key issues?
Yeah, I mean, I'm not aware of any report that was specifically for white workers. I know that that Flex, which is, what is that? Forced labour. I forget the anagrams. Obviously, you can tell that I don't do this. But when I was first doing this report, Flex was doing something similar to me, and I don't think that their report has been published yet, because I think they were doing something that was a little bit more long term. So it might be that we could get the data set from their report if it also included white workers, and also I think actually on the call today is someone who, Tamsin, who I'm due to have a call with tomorrow evening, who I think is from the University of Kent, if I remember that right. And I know that they're also going to be undertaking a very similar research project looking at low paid workers. I don't know if Tamsin's...
Yeah.
Oh,
hi Danielle. That was really interesting. Been listening with interest. I work with the University of Kent, and we're actually still at putting a bid together, responding to a call which is looking at the experiences of low-paid health and social care workers, and it's looking at kind of the experiences of people across different ethnic minority groups. But EHRC, who is the funder for this, would also like the experiences of white health and social care staff in low-paid roles to be included. So yeah, we're still at the development stage of that, and the submission date is next week. So we are fingers crossed. I really look forward to speaking with you more about it. Thank you.
Yeah. So. So Nick, there are other bits that are out there, but you are absolutely right that one sort of crucial piece of research would be comparing what migrant communities and people of colour feel in comparison to other workers who are white. Maybe I'll do that for the next project. If they don't get me back to the Crown Court, I'll do another project.
We had in the chat box a question from Oana. Do you have any insights that you can share with us today about whether the government guidance was suitable and to what extent employers followed this guidance?
It's a great question, and I'm definitely going to, I think, save that for my webinar, because that's one of the areas that I'm looking to sort of analyse. And what we've had to do is obviously break it down industry by industry to look at it. I think it's probably fair to say that generally it was mixed, and there was certainly there was a large proportion of people that said that their employers were following the guidance. So in the early stages, the government sort of issued like 5 key things to do, and it was, make hand washing facilities available, make sure people could socially distance, etc. And generally speaking, employers were doing that. But then in the industry specific guidance, there were specific things that employers were told to do. So for example, on construction sites, they were told to limit the amount of entrances and exits on site, make one-way systems available, make sure that in the canteen people could only pay by contactless, either using your debit card or using your mobile phone. And a lot of those sort of specific things, to my mind, were not happening. And even when they were, I think there was definitely a large proportion of people on some of the industry specific sections of the survey that felt that even the government guidance wasn't sufficient. And so as I pull together the report and do the final findings, that's something that I'll be detailing. And I think that will be encompassed in our policy recommendations as well, where the government guidance in itself just isn't enough.
Christine, I see that your hand's been raised. Did you want to ask a question?
Yes, thank you. Yes, I was just putting it into the chat, but yes, I would. Thank you. Hi, I'm Christine from the HERE Equality and Human Rights Network. I just wanted to ask whether you collected any information when you were doing the survey about any other protected characteristics of people. So, for example, around disability or age, sexual orientation, that kind of thing. Clearly you collected information on gender, but I wondered whether you'd collected any other information like that.
Yeah, we collected age, and we asked if they had any vulnerability, if they considered themselves to be vulnerable. So if there were any health conditions, not necessarily a disability, but something that would put them in the vulnerable category. And we also asked if family members of theirs were in the vulnerable category or needed to shield, because that really, those questions were sort of directly relevant to an area that we tried to explore as well, about risk assessments, because part of the government guidance was that, you know, every employer should be doing a risk assessment, that the risk assessment should be made available to the employee, and that the risk assessment should take into account each employee's individual circumstance, and that would extend to whether or not they themselves had asthma, for example, or had cancer previously and were now in remission, but also whether or not their family members had any of those characteristics and needed to be protected as well, even though they were sort of once removed. So yeah, we do have that data.
Great, thank you.
Great. Are there any other questions? I saw that Liza highlighted something about providing evidence. Did you want to talk about that, or just briefly say anything more?
I mean, just quickly to say that the now hang on, let me get the name right because I don't want to get it wrong. The evidence for the Commission on Race and Ethnic Disparities, which I think is a wonderful title, actually has had calls for evidence out for a while, but that closes on Friday. And just if anybody had missed that, I'm sure lots of you have already done it, the 4 in 10, which is London's Child Poverty Network, are holding a webinar on Thursday, tomorrow. Is tomorrow Thursday? No, the day after tomorrow. And people are welcome to come onto that and put views across, and we'll try and include them all in a written thing that we'll submit on Friday, because I think a lot of people have missed it and haven't realised that they could submit evidence, and that can be from organisations or from individuals.
Great, thank you. A question from Tamsin. Danielle, you mentioned the negative experiences that one of your participants described with the trade union or reps. Did people mention any sources of support and advice that they accessed?
Nothing's jumping out at me, although it may be that I go back and read the case studies and someone's provided information about something specific. There was someone who had a very positive experience from her employer, and that I think they had an assigned health and safety rep who was constantly available on site, was constantly forwarding information and support. So and I can't for the life of me remember what industry that person worked in, whether they were health and social care, or if it was something else. But there have been positive examples, and I'm sure that there are employers out there who are doing the right thing. But even to my mind, even if there's a small percentage of this community that feel, you know, even if there's 10% that have had to access food banks, you know, that's not a huge figure, but it's totally unacceptable. So unfortunately, I will be focusing on the negatives in my report, because I think that it's a drum that needs to be banged, and I think that people need to be aware of the problems that have arisen during this really, really awful time. It's not good enough, I don't think. So.
Great, thanks. Is there anything else that anyone wanted to raise or ask? If not, we can finish a bit early. And Danielle, someone asked about your slides. Is emailing you the best, or just waiting on the published report?
I will send my slides to you, and you can send them to everyone on the call. I don't mind. But do read the report when it comes out, and do attend my webinar further down the line.
Great. Well, thank you so much to everyone that's here. I'll just pop my email in if you want the slides. And we'll finish there. Thank you so much, Danielle.
Thanks.
Thanks, everyone.
Bye.
Bye.